When we do breast reconstruction, is it above or below the muscle? Excellent question. And the answer is it can be both. Let's discuss the pros and cons of doing an implant-based breast reconstruction above your pectoralis muscle or below your pectoralis muscle. Your pectoralis muscle is a fan-shaped muscle that is on your chest. Historically, when breast reconstruction was done, it was placed above the muscle. And then people really didn't like the aesthetic outcomes, so we started doing reconstruction below the muscle. With changes in available technologies and tools and understanding of the anatomy, there's now in the last 10 years or so been a push to move it back above the muscle. Why is that? When a breast surgeon does her mastectomy, she doesn't have to touch the muscle beyond the fascia, which is the thin layer covering the muscle. If I'm going to do under the muscle reconstruction, then I have to cut the muscle. And that is why under the muscle reconstruction tends to be a little bit more painful than above the muscle. And this has been shown in the literature. The other thing that results from a under the muscle reconstruction is that the implant is now pushing the muscle closer to the outside world. This can make the muscle more visible, especially upon contraction. This is called animation deformity. For thin patients and very active ones, it can be very upsetting and they don't like the way it looks, they don't like the way it feels, and it can actually push the implants down and out, which can distort the way the reconstruction looks. There are pros to under the muscle though. It can provide nice upper pull fullness because the muscle is once again between the implant and the outside world. It provides almost a little shelf. So this could be nice in thin people as extra covering. I still don't like under the muscle reconstruction, largely because of the animation deformity and the added pain. So I prefer above the muscle reconstruction. Above the muscle reconstruction, I don't have to touch the muscle. So that's a huge pro. A con of above the muscle reconstruction, which is called pre-pectoral, is now the implant is closer to the outside world. There are less things disguising or camouflaging the implant. So what that means is that the implant can be more visible, especially in the upper pull area, or if you have a thin mastectomy flap, that means you can see the implant more visibly, especially rippling. This is very, very challenging in thin women to correct. And that's why it is worth discussing with your surgeon whether or not pre-pec or sub-pec is better for you. Now, there are studies looking at the below the muscle to the above muscle switch, and I do this quite frequently in my practice, showing that doing this switch results in improved patient satisfaction and aesthetic outcomes. Was your reconstruction above or below the muscle? Were you given the option of putting it above or below the muscle? And if so, what did you choose and why? Let me know below.